We are trying to get with a needle inside the artery, but the problem is that the artery has such a calcification. When we are puncturing it makes really our life very, very difficult to get inside.
A lot of patients are coming too late to us. This is one of these patients. So what we will try today is to avoid the amputation, because this is, let's say, the bad scenario.
Yeah, you read that right. Every 20 seconds. And it's a chronic disease that, according to the World Health Organization, affects around 422 million people worldwide. And it's a chronic disease of which 200 million can develop a condition that leads to the amputation of a limb. This is Indiana, where Derek Six and his wife Tony live, and they've been on the front lines battling this chronic disease for over 5 years, which has forced Derek to endure several amputations. Hey, Derek and Tony. Hey, oh, the devil. Let's do a little bit of that.
Come on in.
Do a little bit of that. Yeah, good to see you guys too.
I see you. Come on in, man.
I can tell when they need to be changed. They start, I don't know, it feels like it's bunched up or something in my sock.
How often do they need changing?
What do we do, about every other day, right?
Every 2 days.
Yeah, every 2 days.
How did type 2 diabetes lead to you, Derek, being told that you'd have to have part of your foot amputated?
The fact that diabetes can lead into peripheral artery disease, that's something I never knew about until like in 2019. And then having a few toes amputated already. The right foot, I'm down to only 2 toes. I've got the big toe, the middle toe is gone, so it's the third toe, the big toe and the third toe. Left foot, I'm missing the big toe. So yeah, I'm down to only 6 toes. Yeah, this side is one that had the big, looked like a big shotgun blast on this side. And how it all regrew with that pig bladder.
When you first presented to a doctor, what symptoms did you have? What was going on with your foot? What did it look like? What did it feel like?
Well, it started off with my right leg was cramping really bad. I had pulled up here to the house, and when I got out, I fell to the ground because my leg cramped so bad. I was diagnosed with diabetes in 2005, and this was maybe 4 or 5 years ago. And it progressed to where I ended up having a sore on a toe that I didn't feel. And then having them just start cutting things off without giving me any other options, you know, it was scary. You know, I didn't know what to do.
It wasn't long after they cut that it was hurting.
Okay. Ooh, wow. I never seen, ooh. Ooh, wow. Ay, ay.
Tony, what was your response when you heard that?
I was devastated because all the medication that they had Derek on, he looked like he was dying. I made an appointment with my family care doctor that I had known for many years. And I brought pictures in of Derek's feet. And I explained to him what was going on. My doctor asked me if he's a smoker. And I said, yes, he's a diabetic and he's a smoker. and he sat down on the examining table next to me, and he just leaned into me, and he just looked at me and he said, Tony, he said, you need to take him to a funeral home and have him pick out his casket. And I was devastated. I had no idea that this could lead to death. It's important with peripheral artery disease that you don't put an elastic tape on too tight, because it can impede the blood flow. So I'm real careful with how tight I put that tape on. When you are faced with amputation, whether it's yourself or your loved one, there is a darkness that comes over you that is like no other that I've experienced.
Tony, tell me about the moment where you met the person who gave you an alternative to the amputations that you were being offered.
I was referred to Dr. Mustafa. We were referred to Dr. Mustafa from Way to My Heart. And we drove 3.5 hours to Grand Rapids, Michigan. We met with Dr. Mustafa, and they explained in a short amount of time what we had been looking for weeks of hospitalizations.
Dr. Mustafa, who works here in Grand Rapids, is the clinician and specialist that ultimately brought Derek's amputations to an end through a very different approach. Dr. Mustafa, how are you, sir?
Hey, Mikey, how are you?
Do a little bit of the COVID handshake. Great to meet you.
Same here. Let's go to the operating room and chat in there. So what you see here is Derek's foot when he first presented to us, and this is what we call gangrene changes and a wound that is not healing, and it extends deep into the foot. Also, he's got gangrene on his toes as well. And when he came in, he was basically told that he doesn't have any options for treatment except for amputation. So we did what we call selective angiography, where you take a picture down to the foot. Now this is the foot here is white, and anything you see dark now, that is a good thing.
What did you diagnose Derek with?
We diagnosed him with a disease called critical limb ischemia. I explained to them that PID and critical limb ischemia are same family of disease. Just that critical limb ischemia is an advanced form of PID, which is a peripheral arterial disease. And that disease usually affects a lot of patients, but sort of ends around the knee area, and it's treated the most, where critical limb ischemia can involve many arteries above the knee and below the knee, but primarily below the knee and all the way below the ankle. But when it comes to the vessels or arteries below the knee, this is where things stop, and many physicians don't feel comfortable going beyond the knee or beyond the ankle to save the limb. And Derek was one of those patients actually that came in with disease that involves the arteries below his knee as well as below his ankle. This is the artery that is going to supply this area that I showed you where the ulcer is present, which is right here. So no one is actually taking the time to open this artery that is going to be connected to the foot where Derek's problem is. So this is a balloon here in the top of the foot, but it goes inside the foot between the bones. And remember what I showed you, that wound that he had right here? Look at the wire that we lead with. This is a 14,000 of an inch wire. And now we have the balloon right down into where the wound is. So now we feel confident that after opening this balloon, inflating the balloon in the vessel, this black dot here indicate a secondary balloon that we used, because we want to make sure that he gets a tremendous amount of blood. So why is blood so important? because the blood carries the oxygenated red blood cells into the wound. Not only that, but also the blood carries all the progenitor cells, the nutrition, and all the compounds that we need to build the regeneration of tissue and cells and skin to heal the wound from the inside out. Had anybody done this to him before the wound gotten that bad, he most likely would not have gotten that sick. Probably this would have been a lot easier for him.
That whole side was black and like mummified. But then Mustafa opened me up and those healed up. You almost can't tell that there was even anything there. As soon as the local anesthetic wore off, I could tell that I had blood flow because my feet were nice and warm. They didn't hurt to move, even with what toes I have left. I used to always complain about my right foot feeling like it was in a block of ice. That was almost immediately gone when he opened me up.
We didn't know that this was actually a blood circulation problem. When Dr. Mustafa opened up his arteries below the knee and into the foot, you could see an immediate change in the skin. The wound started to slough off the gangrenous tissue, and new skin started forming. And I felt like the sun was rising on our life again, because all of a sudden he was making a rapid recovery from looking like he was dying. And then all of a sudden, when that blood flow was restored, and honestly, and our hope was restored, he was beginning to be like a new person again.
Dr. Mustafa, why, when you saw Derek's foot, had it endured so many amputations?
Unfortunately, in the United States today, 54% of patients get an amputation that is not necessary, or an amputation without a diagnostic angiogram. Diagnostic angiogram meaning that you put dye and you take a picture to see what kind of arteries are open or closed. In Derek's case, he's had multiple repeated amputation, which we call a progressive amputation, until the major amputation happens, because no one knew how much blood was getting to the foot. And the scenario of, okay, let's treat it to the knee and see what happens if we amputate part of the foot, is barbaric, is old-fashioned. It should not be done today. There's a great method of vascular surgery bypass, for instance, to the knee, and then from there you can actually continue to treat below the knee. Like our friend Theo, for instance, right? He will be able to bypass to the knee and then go through what he just bypassed and open the rest of the arteries of the foot and save the foot, like in our patient here. Everyone should get a second chance or a second opinion before they get an amputation, because amputations are for life. A second opinion is not for life.
This is the occlusion of the superficial femoral artery. So we're gonna do a puncture at the level of the common femoral undergrade, and then we have also a high-grade stenosis at the fibular artery, and we will try to puncture at that level of the common femoral artery. Here is challenging. There is the alternative of doing a bypass surgery. However, he's on dialysis, he's a multimorbid patient, and we will do anything to avoid it. Okay? Okay. There is no other option. We have to save the limb, as always.
This is Athens Medical Center, and inside, Dr. Theo Bistas is briefing his team for a 2-hour-long operation in an attempt to save the limb of a patient from here in Athens. my scrubs on because I'm meeting Dr. Theo in the hybrid room, which is just behind those doors. And he should be. Dr.
Welcome.
Theo, how you doing?
Come in.
Quick COVID handshake.
Good to see
Pleasure to
you.
meet you. This is the hybrid room.
This is the hybrid room Prometheus in Athens Medical Center here in Athens, Greece. In this case, we're gonna do the whole procedure with X-rays. That means exposure to radiation. This is the reason why we're wearing these glasses and we're wearing this protection. This is the classical problem that we face every day. That means this patient underwent a wound cleaning of a necrosis at that level without prior revascularization. That means without prior improvement of the perfusion of the leg. Now, if we will not be able to open the vessel, the patient is at a very high risk for a major amputation with all the consequences of this action. Through this C-arm, through the X-rays, we see the shadow of the wires into the screen on the other side, and by this way we can guide our intervention.
What am I looking at the moment, Dr. Theo?
You see an angiogram, you see a contrast agent given by the femoral artery, and we see the contrast agent staying in the vessels. You see a sheath, and you see a wire, but not always following our instructions. Here you are, we're doing very slow movements in order to get inside the artery. We're trying to really make a rendezvous technique. That means a wire from the forefoot upwards, and we will bring another wire from the groin downwards in order to bring the two wires in the same lumen in order to have a unique lumen and to open the vessel. This is a railway. Through this railway, we're going to bring all the balloons and the stents on the parts of the artery that have the disease, and we're going to treat them. You keep the wire under tension, and you can bring, even through the most difficult and challenging lesions, the balloon inside.
And are you having particular challenges with this patient?
Yes, the particular challenge was that it is a very long occlusion, and there is a lot of calcium in the vessel. We had to change multiple wires because the calcium destroyed the proximal part of the wire multiple times. And now the odds to save the limb are really have been increased dramatically.
So are we at the point of the operation where you can say one way or the other whether the limb is going to be saved or whether you'll have to amputate?
Let's say after the balloon angioplasty, which is the most, let's say, important part, because we're going to see if this vessel will open. This is the part of the operation where we're going to be pretty sure that we have saved the limb.
And when is that? When's the balloon?
Actually now we're inserting the balloon at the moment. You see how small the balloon is. This is a balloon that will be inflated. This is the proximal part of the balloon. This is the end of the balloon, and this part will be inflated, will be open, and will really open the vessel accordingly.
Can you show me where the balloon is?
From here to there. Done. We have done a really good job, and we have opened the whole artery that was closed. Now, final details in order to have a nice angiographic result, and then we are ready. We are really happy because this leg has been saved.
How you feeling?
Okay. A little off balance.
A little off balance? Yeah, but
The
it's
offloaders.
keeping the blood flowing,
Yeah, helping to build collaterals.
keeping the lymph system clean.
I have more feeling in my feet now, and quite frankly, my feet are very ticklish now, which they've always been. But it's amazing, even after all that they've been through, that they are still ticklish. So I think that's great what Dr. Mustafa and Saab have done and are doing with other patients.
So Dr. Mustafa got your tickle back.
Yes, he did. Yes, he did. And I thank God for Dr. Mustafa. You know, and to even just talk to the man, he's a great man.